Welcome to the Module 2 Synopsis, Connections, Understanding Mental Health Practices. Let's take a look at the module objectives, read through those, and just try to remember some of the activities that we did and the lessons you learned related to those module objectives. Okay, I hope you took a good look at those objectives because I want you guys to let me know which module objective resonated with you the most. Which one did you relate to the most? I asked you guys in the last module synopsis to tell me what you thought psychiatric mental health nursing is. So, registered nurses in a lot of settings provide care for clients with mental and medical illnesses. Nurses who specialize in psychiatric mental health nursing provide for clients' well-being through prevention strategies, patient education, while also using the nursing process to provide care for clients with mental health and substance abuse disorders. So, you will always use the tenets of mental health nursing in your everyday nursing practice. However, a psychiatric mental health nurse takes care of patients that are hospitalized for a psychiatric or mental health event that requires an inpatient level of care. I really want you guys to make sure that you understand the application of the nursing process in the context of mental health. The nursing process itself is a critical thinking model based on a systematic approach to patient-centered care. So when nurses are using the nursing process, they're performing clinical reasoning, making clinical judgments, and they're providing the care to the patient based on these various steps. So there is the mnemonic ADOPI or ADOPI. I want you to take note that there are some differences in nursing process terminology when it comes to NCLEX NextGen. I did include a little synopsis of that in the modules. So if you want to take a look at that, that'll help in terms of, okay, what do they call diagnosis now? Well, they call it analysis. So in any case, be familiar with the steps of the nursing process and think through how the application of each step translates into psychiatric and mental health nursing. So let's break down assessment a little bit. We have the ANA competencies that we really all need to follow in terms of assessing our patients. We also have the mental status exam, the mini mental, the cultural assessment, psychosocial assessment, and of course we have the other assessments like spiritual assessments and also different scales and designs for each of those. So I want everybody to take a minute, think back through the module, think about the assignments, the assessments that I had you perform and study. What was the most difficult assessment concept for you to grasp? And then on the other end of that, what was the easiest assessment concept for you to grasp? We're just going to touch briefly on nursing diagnosis. We're going to go over how to properly create one of those in later modules. But I just wanted to make sure that in the reading that you took a look at the ANA diagnosis competencies and the definition for nursing diagnosis. Also to touch on prioritization, you really need to be looking at identifying the most significant problem so that you can do the most important interventions in the next step. Make sure that you're taking into account Maslow's hierarchy of needs in the process. We will go over Maslow's hierarchy in the next module as well. Outcomes identification. So also, again, make sure you've taken a look at the ANA outcomes identification competencies and that you've looked over SMART goals. Now, we will have some specific examples in the next module regarding writing SMART goals and SMART outcomes. However, I just wanted to talk a little bit about outcomes in that they're a measurable behavior demonstrated by the patient who is responsive to the nursing intervention. That's important to remember. And then a little question for you guys. Which one of those ANA outcome identification competencies is the most difficult for you to understand? When we talk about planning, we're talking about ANA's planning competencies, obviously, and I want you to take a look at those. But we're also talking about planning nursing interventions. So I will give you a couple of examples for nursing interventions planning wise. So from your book, there's sample nursing interventions for risk for suicide. So nursing intervention, the nurse will use an evidence-based process to conduct a suicide risk assessment. Another one would be document and communicate the client's overall level of risk for suicide with the treatment team and the plan for mitigating the risks for suicide. So there's some rationale to go along with that. The first one, the rationale is patients with suicidal ideation vary widely in their risk for a suicide attempt depending on whether they have a plan, intent, and a past history of attempts. So when you're thinking of planning, thinking about planning your nursing intervention in the context of what's going on with the patient, and you want to make sure that you have an evidence-based rationale to go along with that. For implementation, there's a few different parts to this. I want to make sure that you've looked at all of the associated competencies. So there's the ANA implementation competency, the coordination of care competency, health teaching and health promotion, and then there's also the APNA's pharmacological, biological, and integrative therapies competency. There's milieu therapy, and there is relationship and counseling competencies. Take a look at those boxes in your book, familiarize yourself with those different competencies and the different aspects. And what I'm going to just chat about quickly is the psychotherapy and biological therapies we're going to go into in different pieces when we focus on therapies and pharmacological interventions. But milieu therapy is defined by the American Psychiatric Nursing Association as a safe, welcoming, supportive, and functional physical treatment environment. Milieu therapy includes nursing interventions used to assist healthcare consumers to make positive change and promote recovery in a therapeutic milieu. You'll hear milieu, therapeutic milieu, throughout the text in most of the modules, so I just wanted to make sure that we touched on that a little bit more specifically. In evaluation, there are, again, American Nurse Association evaluation competencies, but mostly what evaluation focuses on, and even these competencies, is the effectiveness of the nursing interventions. And you're doing this by reviewing the expected outcomes to determine if they were met by the time frame indicated. This is where your analysis of data from your assessments come into play. When you are evaluating and reassessing, you should reassess every time you interact with a patient, every time you discuss their care plan with the interprofessional team, or you review updated laboratory or diagnostic tests. So keep that in mind. A reassessment, reevaluation is a continuous process. And ideally, when the planned interventions are implemented, the patient will respond positively and the expected outcomes are achieved. However, when interventions do not assist in progressing the patient towards the expected outcomes, you have to revise that nursing care plan. We'll be getting into psychiatric and psychological theories later, but there's some development theories that are pertinent to this module. First one is Freud's psychosexual theory of development. He believes that personality develops during early childhood, and the childhood experiences shape our personalities and behavior as adults. He believes that individuals have to pass through a series of stages during childhood, and if you lack proper nurturance and parenting during that stage, you become stuck. So the 5 stages are oral, anal, phallic, latency, and genital. So Freud's ideas are not supported by research in modern psychiatry or psychology. However, they did give way to much of the later theories and still a lot of the therapies that are performed today. Erickson's psychosocial stages of development, you guys should be pretty familiar with this by now from your nursing care plans, but he took Freud's theory and modified it into a psychosocial theory, taking out the sexualization aspects. Piaget studied childhood development by focusing on children's cognitive growth. He believed that thinking is an essential aspect of development, and children are naturally inquisitive, but do not think and reason like adults. The different periods that Piaget looks at is the sensory motor, pre-operational, concrete operations, and formal operations period. What is notable about Piaget's theory of development is that it's generalizable across cultures, and that can't be said for all of them. So I'm pretty sure going over Freud's theory made this question pretty easy, but what is one element of one of the theories discussed that you feel has no relevance in mental health today? Now remember, even though Freud's theory as a whole has been discounted, other theories have been built off of those. So be judicious in your choice of the element of the theory that you feel has no relevance. At the end of subchapter 4.3, there is a box or boxes that include ANA's respectful and equitable practice competencies. If you didn't take a look at those before, please make sure you take a look at them now, because I want you to give me some practical examples, at least one. So, what is a practical way that you can tell me that at least one of these competencies can be applied? Embodying professionalism in nursing is incredibly important. Autonomy. So when you get that license, you can practice fairly autonomously. It means you can do assessments, make clinical judgments. You're taking care of people with a great ability to do so independently under the direction of the providers. Take that seriously. Protect your clients, protect yourself, and be responsible with your autonomy. So there's a difference between accountability and responsibility. Accountability is internal. Accountability is taking internal responsibility for actions and making judgment calls and behaving in a way that you can be accountable for. You can say, yes, that was me. So accountability is internal. Responsibility is external. As a nurse, you have responsibilities to carry out tasks. You have responsibilities to take good care of other people. You have responsibilities to follow the rules. So that's the difference. Excellence in nursing care is related to the first two things we talked about. There are caring behaviors. Always be caring. It's not our job to go into a room and just flit around because we've had a bad day. We have to demonstrate caring behaviors when we're with our clients and in the setting of our workplace as a nurse. Integrity. Operate with integrity always. Professional service and relationships. This means it's very important when you feel ready to become a mentor, a coach, support system, preceptor for other nurses so that you can help spread knowledge. Boundaries. Always keep your professional boundaries with coworkers as well as clients, and teamwork. You have to be a contributing member of an interprofessional team to be successful in nursing and to provide excellent care. So always be a good team member. Do what you're supposed to do. Go above and beyond when you can, and make sure you always communicate. Okay, I want you guys to give me two examples of unprofessional communication. I'm not talking about or non-therapeutic communication. I'm talking about unprofessional communication. So, how do you know what is appropriate communication and what's not appropriate communication? A lot of it is common sense, and a lot of it you build from working with patients. So, focus on the person, not the mental health condition. Use language that is easy to understand. Focus on strengths and abilities, not issues and problems. Check that you've correctly understood what you've been told, and check the person has understood what you said. Ask, never assume, and remember that your role is to support the person. Check what they support, what they want and need, and ask before jumping in and helping. Don't pretend to know how someone else feels. Use terms that show pity. Use inappropriate words that are condescending or stigmatizing, like psycho or crazy. Don't blame the person for their condition. Use jargon. Be judgmental or argumentative. Don't show any form of anger or hostility. Don't be sarcastic and make jokes about their condition. And don't treat somebody else like they're inferior. Some key points. Patient-centered care. Always prioritize the patient's needs in all interactions. Listen actively. Fully focus on the patient. using both verbal and nonverbal cues. Show empathy. Use open and positive body language. Those can be very effective communication signals and methods. Patience. You need to understand each patient's needs thoroughly to ensure you can provide an appropriate response. If you don't have patience to hear them out, you're not going to be able to take good care of them. If you're in charge of the environment, select a communication setting in consideration of the patient's behaviors, preferences, and values. Ensure proper ventilation and be mindful of noise. Use clear language in a way that's easily understood, particularly when interacting with a diverse group of clients. Remember to maintain eye contact at all times so that your patient knows that your focus lies on them. Greeting. When you encounter the patient, say hello, introduce yourself, clarify your position. Talk to the patient directly and answer using words instead of only nodding or shaking your head. Aside from my stellar virtual lecturing and synopsis abilities, what really held your interest this module? Let me know. Well done, everybody, and keep exploring.